Joining us now on the program is Dr. Priyesh Patel from Twin Lakes Family Medicine as we're getting into the spring season, getting back outside, getting more active again, and it's always a good time as we're talking about rejuvenation and rebirth to go back through those doctor's appointments and get those regular checkups. Doctor, thanks for being with us today.
Hey, how are you? Doing well. How's everything going today?
Going well as well. We know that that you have patients coming up, so we'll make this nice
That's okay.
nice and quick for you. I don't want to take too much of your time, but it's a really important time of the year, and it really always is to get updates from your primary care provider, especially if you haven't been there in a while. We know that it's 2023, but we're not that far removed from the COVID-19 pandemic where a lot of people were not going to the doctor. So just how important is that annual or twice annual checkup with your primary care provider?
Yeah, I think it's extremely important. I mean, I like to look at as primary care doctors as like the screen for you to go out to other doctors. We kind of do your initial stuff, right? We look at your basic labs. We obviously do your blood pressure when you come into the office. And based on everything that we gather, like you were saying, from your initial physical or whatnot, wellness check, we can see if something is or is not going on with you. Likely, we like to see patients having nothing going on with them, and then we can just follow up with them in 6 months, like you were saying, 2 times a year. Unfortunately, sometimes we have patients that something else might be going on, and we would have to then, kind of get to where we need to get. So I absolutely think it's so important for you to have that initial physical slash wellness exam. And like you were saying, especially after COVID, now that COVID is we're kind of getting back into the groove of things. I mean, you see people coming out more. You see people being more active. They should definitely start coming to the doctor's office as well. I definitely agree with you.
And especially if they haven't been there in a while or they haven't taken their kids there in a while, does it depend on age or health level, how often you come in, or should it really just be that standard of once or ideally twice a year?
Yeah, sure. So we definitely do that once per year physical, right? Absolutely. And then based on your labs, right? So for instance, I have a patient that might have chronic kidney disease or diabetes. Those patients we need to see them a little bit more regularly. A diabetic, we might check their A1C value every 3 months, let's say. Another patient might have chronic kidney disease where I need to watch his kidney function. So I might see him 3 times a year. Also, we have patients that will go see other doctors, and we like for them to follow up after those visits, just to keep along their health and keep them being maintained. Now, with age, obviously, kids usually are doing much better, and they just need their basically yearly checkup unless it is warranted for some other reason. But I would say getting out, getting to the initial beginning visit is the most important thing. I sometimes see patients that haven't been seen in 2, 3 years, but then I get them going where I get them in, and then I can see them at least once a year if needed. We get them just to be doing something regular on a yearly basis is something that really matters, though.
And it's been good too because over the last few years, especially not necessarily for those physicals or for those labs, because those obviously have to be done in person, but for other checkups too, or even just that secondary checkup of the year, you can do that via telehealth also. How has that expanded it and really changed the game for patients, obviously, but also for primary care providers like yourself?
Yeah, absolutely. Telehealth is a good way for us to keep in touch with the patient. A lot of patients, you're right. Even though COVID is completed, some patients are still not ready to get out of their house and come see us in office. So those patients to be able to at least have some type of video conference like me and you are doing right now, or I can also we also do just straight phone calls, which is fine as well. But it still allows us to see the patient, get to know a little bit about what's going on, and then we can kind of work from there. So they don't necessarily have to come into office. We prefer in office these days, especially because it's always better to see somebody, do a physical exam on the patient. But telemedicine has allowed us to at least kind of, if someone's not 100% ready to come out, we can at least see them or talk to them on the phone. So it's really good. And after COVID, it's something that becomes pretty much standard with most doctors today, I would say.
We're joined on the program by Dr. Priyesh Patel from Twin Lakes Family Medicine on our show today. You can find more information and get in contact with him and the other professionals at Twin Lakes Family Medicine at twinlakesfamily.com or call them
Yes,
at
sir.
248-451-0668. Dr. Patel, as we get into the warmer months of the year, too, we should also be keeping in mind our personal health as we get back outside, get active in our yards and in physical activity. Certainly our kids as they're at home and playing over the summer. And one of those primary hazards can be the heat. What really should people be keeping an eye out for themselves and for their families as we go from the cooler months of the year now, the more temperate months of the spring and the summer, and into real thick of the warmth and the humidity?
Yeah, absolutely. You know, a lot of kids like to stay active. I being myself, I'm from Michigan, so when the summertime came around, I was always outside playing football, doing whatever, going to like subdivisions and playing in houses that were being built. Like, I understand that number one importance is hydrated, not hydrated with Mountain Dew or Pepsi or something like that. Hydration with obviously water is very good. A sports drinks offers a lot of sugar, but they're still okay. I mean, as far as the electrolytes are concerned, it's beneficial to drink something with important electrolytes in them, with you know, like sodium, potassium, other of them have, because it exchanges those electrolytes in your system. When you just drink water, it's like you're drinking it and it's going back out. Yes, it's hydrating you, but the electrolytes is what gets exchanged in your kidney tubules, and that helps you get hydrated. I don't know if you've ever been really tired when playing like sports or whatnot, and you drink some Gatorade, it automatically energizes you. I have done it myself, and that's why you see athletes out there always they're drinking Gatorade when you see them on the floors, when you see them at games. Um, it's important to stay hydrated, especially in the hot months. Also, you want to shade yourself. You want to make sure you're wearing a hat, sunscreen if you're the type of person that gets burned. These are things that are very important to protect yourself as well. It's a big combo because it can get really hot in Michigan. And I mean, people underestimate that, especially if you're going to go to the beach for the day. Although we're in Michigan, I mean, it gets super hot. So I would say the biggest things are sunscreen protection, staying hydrated, and making sure you're in some type of shade as well to protect yourself from the heat. Even if you're going in the water, yeah, you might think that you know that's okay, but you still get hit by the sun, and then the sun hitting the water and the rays coming back, deflecting at you. So you need to make sure that you stay protected.
Plenty of things to be keeping an eye out for as we go and transition from the cooler months of the year and the
Yeah,
more temperate parts of the year we're in now and into the warmth, as well as on other health and medical matters as well. All the more reason to go see your primary care provider and ask them as many questions as you may have. Dr. Patel, thank you so much for joining us today.
yeah. Thank you, Mr. Keff. Thank you so much.